CBS 46 News presents Public Affairs on Peach.
Good morning and welcome to Public Affairs on Peach. I'm Tracy Hutchins. Atlanta and our country are in an opioid crisis. For months now, CBS 46 News has brought you stories about the opioid epidemic. It's not only dangerous for someone to take it, it's even harmful to touch and breathe it in. That's why hazmat teams rushed to the Duluth Police Department when fentanyl leaked out of a box that came from the GBI crime lab recently. The two officers who were in the car were checked out. They were decontaminated. And now we are glad to say they're okay. And there's this. Our Megan Packer says there is a fake fentanyl being sold on the streets today.
We were planning on kind of sliding this one over, but that's what we wanted to ask before.
Not long ago, Justin Jackson's focus was on something much different and much more dangerous, getting high.
I was using just about any drug out there. My primary two was heroin and meth.
He's been clean for almost 18 months and is working at The Zone in Marietta, a recovery community organization under the Davis Direction Foundation.
Nearly as bad as I thought it was going to be.
Jackson knows firsthand the danger of illegal drugs and the benefit of this drug, Narcan, or naloxone, which reverses the effects of dangerous opioids. He's received doses of it after several overdoses and now hands it out to people who may need to use it.
I know it saved my life on more than one occasion, and I know it saved other lives on more than one occasion because I've used a nasal injector before on someone else. I still have family out there. I still have people I seriously care about that aren't interested in recovery at this point, and there's nothing I can do about that.
He hopes to get through to others through education.
And that was Megan Packer reporting. Joining me now is Nellie Miles from the Georgia Bureau of Investigation. Nellie, thanks for being with us. I want to start with the basics here. What is an opioid for those who may not be aware?
Well, an opioid is actually a substance medically that is meant to relieve pain. But the problem becomes it is a drug that creates euphoria, so people get very addicted to it. There are opiates that are part of the opioid family, and opiates are essentially morphine-like drugs, so they produce these certain highs that are similar to morphine.
And you brought some examples to show us here too, what the GBI really has to deal with on a day-to-day basis.
We're responsible for the crime lab, and what we realized years ago when we're dealing with drug trends, that the crime lab is a repository for a lot of information. And so a couple years back, as we realized that there was a crisis and we were on the verge of a crisis, we started tracking the trends. And what we found is that there was an increase in prescription pills. And it was primarily these opioids. They were oxycodone, hydrocodone, methadone. And then when people couldn't get access to pills, the replacement drug became heroin. And we started to see a rise in heroin. And we were astonished to see heroin make that type of comeback. And then one day, as we were looking at the results, we started to notice a drug called fentanyl being laced with the heroin. And if you look right here, fentanyl is a very fine powder, and just to be clear, this is not fentanyl. Right. We would not be able to bring that in a studio. And we started to see this. And what we realized is that clearly there was a demand. There was a demand for something to replace those effects. But the problem with fentanyl is that fentanyl is transdermal. That means it can be absorbed through the skin and even inhaled. So what we're seeing now is as we look through the history, there's this drug that's now showing up. Here is fentanyl here, and this fentanyl takes a very small amount for an overdose. And as we progress through the heroin, we see carfentanil. Carfentanil is now showing up in the heroin supply.
And there's so little amount of that. It's like one little grain in that little vessel there, and that's all it really takes.
That's all it really takes. In a hospital setting, fentanyl is used to treat long-term patients in receiving care with cancer and other long-term medical conditions like that. But when you put something like this in a heroin supply, it no longer becomes this is a drug, this is a poison that's being entered. And so here lately what we're seeing is that there are new variants, so we call them analogs. And these are fentanyl-like drugs or derivatives. And so there's a whole new crop of them that are showing up, and we're constantly having to monitor them and track them. And in those cases, what we're finding is that a lot of them are 50 to 100 times more potent than morphine. So what that means for the user is that if there is an overdose situation, there is a strong chance that it can take multiple doses of the overdose the drug that's meant to reverse the overdose, the naloxone, and that's an issue.
And a lot of people don't know what they're taking. So what are we seeing here? Are the drugs coming in from out of state to Georgia, or are people kind of making batches of them in their homes?
Well, what we're seeing is that these drugs are primarily manufactured overseas in places like Asia and China. And so in terms of distribution and how it gets to our state and the state of Georgia, they take the traditional distribution channels, and unfortunately people can get them in the mail. And so when they come here, it takes very little, and unfortunately people just get hooked.
And we talked kind of before the segment, too, about this fake Percocet. There's a yellow pill that was out there recently. The GBI issued a warning after several people in Middle Georgia died when they took these yellow pills. They looked like Percocet. That's what they thought they were. So are those pills still circulating, or is that under control now?
This was a big problem for us. We had about 30 patients in a very short period of time check into a hospital, and they all reported similar symptoms. A lot of these patients said they took maybe 1-2 pills max. They thought it was oxycodone. It was stamped Percocet. But when we tested it back, we found it was a brand new fentanyl analog that the GBI crime lab had never seen before. It's called cyclopropylfentanyl. We had never heard of it. But what that showed was this was a very bad experiment that went awry. And since we put all the media messaging that's gone out, social media, every type of way to let people know, don't take the yellow pills. Those pictures were circulated. We haven't really seen them in the crime lab since then.
That is the good news in all this. Certainly you have your work cut out for you at the GBI. Nellie Miles, thank you for being with us. We appreciate it.
Thank you for having me.
Well, the toll of opioids, the human toll, you'll hear from Georgians who've lost loved ones to the drugs. That's when Public Affairs on Peach returns.